Welcome back to Midday Kentucky, everyone. Well, I'm here with Dr. Jared Nims, one of our experts and owner of Commonwealth Plastic Surgery. Now, new data has been released by the FDA and has linked implants to cancer. Take a look at this story on Good Morning America last Wednesday.
This is about a link between breast implants and a low but increased risk of a rare type of cancer called large cell lymphoma. Take a look at these numbers. Over the past 6 years, there have been approximately 1.8 million breast implant surgeries done in this country. The FDA has tracked 359 cases of implant-associated lymphoma that included 9 deaths. Most of these cases seem to be in the textured or gummy bear variety of the implants, but it is important to remember when you look at these numbers, an increased risk of a rare event is still a rare event.
Hearing that study now, and it is from the Institute itself, these numbers were coming back from 2011.
Correct.
What is concerning and what should we be concerned about?
I think the main thing is to look at what kind of implant you're getting and why. So that's a conversation that a patient needs to have with their doctor and decide what is best for them. For most people, using that textured implant may not matter, but for some, it obviously will. The most common type of implant is still going to be the round, smooth implant.
Really?
And that's the one that most people will wind up getting.
There was a lot of conversation, maybe about 2 years ago, Dr. Jared, about the gummy bear. And everyone says, oh, I'm getting gummy bear implants.
Right.
They highlighted that today.
Yeah.
So what does that mean in replace of a normal smooth implant?
Well, the implant manufacturers have been coming out with this new textured implant saying, hey, look, it's the latest, greatest. It is also the most expensive. For most people out there, they're sticking with the smooth round implants. And if you look at the incidence of this type of lymphoma, it is increased in those textured implants anyway. So their risk of getting that is less by using the smooth round implant.
Okay, so I would assume that most people would know what type of implant they're having put in, yes?
I hope.
Okay, well that's all about research and education with going to your cosmetic surgeon and plastic surgeon and making sure you have the correct information. If you have a textured implant placed in your breast, is it something that they should be coming in and having a conversation with you about, or going to have a mammogram?
It is worth a conversation with the plastic surgeon. I don't know that it's worth taking them out. The recommendation right now from the FDA is that if everything is going okay with that textured implant, to just leave it alone. Now, if someone does have problems with swelling, with pain, with redness, something like that, then that is a conversation that you need to have with your plastic surgeon and perhaps have studies done to follow up.
Okay. Now, there are a lot of thoughts out there. Women I know talking on this show and also in my past shows say you shouldn't be having mammograms whilst you have a breast implant.
I highly disagree with that.
Totally, thank you.
Okay.
So this is something that people, you know, if you have those symptoms that you're just explaining, and we're not talking big numbers there, but I think it's something, because we talk about it all the time, that we wanted to let everyone know. So when someone comes into you, what do they need to ask you to begin with in regards to having a breast implant?
They need to ask about what kind of implant, why that implant is going in, where it's going to go, where the incisions are going to be, what their follow-up is going to be, and so forth.
Okay, well, thank you so much. We really appreciate it. If you want to find out more information about Commonwealth Plastic Surgery, there it all is up on the screen right now. Hey, Dr. Jared Nims has great information. Even if you just want to have that conversation, give them a call and, of course, go over and have a consultation. We really appreciate you watching Midday Kentucky, everyone. Back after this short break.